Hello, everyone. Good afternoon. This is Kellyanne Koch over at Compliancy Group. Happy Wednesday. I hope all is well. The time is now 2 o'clock Eastern, 1 o'clock Central, 12 o'clock Mountain, and 11 a.m. Pacific. We will start the webinar in a couple of moments. I'd like to give everyone a chance to log on and get comfortable, grab some coffee, and we will begin shortly. Thank you. Hey everyone, good afternoon. Kelly Koch here over at Compliancy Group. I understand the webinar is supposed to start about 2 o'clock Eastern time. We're just going to give it a moment to let everybody settle in and log in and grab a beverage of choice, and we will be beginning shortly. Thank you. Hi everyone, good afternoon. My name is Kellyanne Koch and I work here at Compliancy Group. I want to take a moment to thank everyone for attending our webinar this afternoon, Compliance versus Security, why you need both to be HIPAA compliant. We are going to cover a lot of ground today, so we're going to get started right away. First off, a little bit of housekeeping in reference to our webinar today. The webinar will be recorded and we will be able to get you a copy after the fact, so that is not an issue if you miss anything. Also, we are going to be able to answer questions during the webinar as well. If you look on your side panel there is a question option where you could type in. You can also type in the chat as well, and I'll answer questions as efficiently as I can as they come in. Also, at the end of the webinar today, you will be prompted to answer two very quick questions that will take you a whole 5 seconds to answer. We appreciate it if you could do so. And most importantly, everyone, there are no silly questions about this stuff. It's HIPAA. So I am more than happy to answer questions online or offline as well. We're here and we're happy to help. So just to give you a quick background on me, my name is Kelly. I'm a senior account manager here at Compliancy Group, and our job is to educate everyone on what needs to be done for HIPAA compliance. We also do indeed offer services if you need assistance getting your office, organization, practice HIPAA compliant. We are more than happy to assist. My contact information will be at the end of the webinar. We are always able to have a conversation, no obligation there, of course, just to go over your compliance for your office, for your practice, for your organization. A little educational call. We're more than happy to set that up for you. That's not a problem at all whatsoever. Just to give you a little background on our company that we kind of know what we're talking about when it comes to all things HIPAA. We've been doing this for a really long time, guys. The company was founded back in 2005. Prior to that, our team members are classified as large-scale auditors, where they would actually fly around the country face-to-face and help organizations become HIPAA compliant. And as we were doing so for years and years and years, we kept on receiving some phone calls and some emails from smaller to mid-size organizations, smaller to mid-size businesses and practices. They needed help. You know, they needed to be HIPAA compliant. They really weren't sure what HIPAA was and what needed to be done, and they needed a leave behind tool. They needed something to help them maintain that compliance year after year after year. So the platform that we use, which is called the Guard, I affectionately call that the big HIPAA binder in the sky. That is how we are able to achieve HIPAA compliance for our clients. We also documented and illustrated as the law requires and absolutely support it, supporting it in a myriad of ways. We actually assign coaches to all of our clients one-on-one for support. We have an entire customer success coaching team, CSCs, that can answer questions and address concerns. And we do have audit response. Knock on wood, if something happens, we're going to help you with that as well. The good thing about all this nonsense and craziness is that in all the years that we've been doing this, we've never failed an investigation. We actually have a clean track record with the US government when it comes to possible infractions or HIPAA violations. Because of that methodology that we use, having the coach walk with you through the process, it truly it helps so many organizations overall, give them a sense of peace that they're able to tackle this head on without all the craziness that 1,000+ pages of regulation give you. We are HIPAA recognized leaders, and what that basically means in plain English is that most major associations across the country, anywhere from the American Dental Association to the American Optometric Association to our partners and business associates over at ChannelCon and CompTIA, things of that nature, think that Compliancy Group, as I say, is the bee's knees. So long story short, we're very blessed in what we do, and we're very happy to help as many organizations as possible with all things compliance, because HIPAA is really so convoluted. There are 1,000+ pages of regulation, and the government's basically telling you, hey, give it a go and make it your own. Make it effective for you. So of course it's going to be crazy. Lots of misunderstandings there. You have compliance, which is the regulatory side, and then you have security, which is the technical side of things, and they do have to marry together. They have to merge together in harmony and work together in order to be effective, in order to be efficient for your organization. Nowadays, it's not just HIPAA. You have this high-tech act, the high-tech rule in effect, which is now merged into HIPAA, which is a part of HIPAA as well. You have what's called meaningful use, MIPS and MACRA attestations. It's going to be a lot of acronyms going on this conversation today. And that is in reference to if you accept different types of insurance from Medicare, Medicaid, Medicare Advantage, state like Medi-Cal in California, Health First in New York, things of that nature. Nowadays, you even have this regulation, this rule called the omnibus rule, the on-the-bus regulation. Who's on the bus? What is the bus? What the heck am I talking about? Well, we're going to get this at all in this conversation. Definitely feel free to put questions there in the chat. We'll get to those in real time as we go throughout. So much to learn about HIPAA. And quite honestly, most people, including people that have been doing this for a long time, do not know exactly what needs to be done for an organization to be deemed HIPAA compliant. And who needs to be HIPAA compliant anyway? Well, common sense. If you work in healthcare, you're going to have access to this information called PHI, protected health information. And then who has access to it, and what do they do with it, and how do they keep it safe and secure? Well, there's two types of people in the world that need to be HIPAA compliant. You have covered entities. And covered entities are the people that touch and handle and deal with protected health information on a daily basis, either face-to-face or in person, or nowadays electronically. ePHI, electronic PHI. So I want you to think of the doctor's offices, hospitals, clinicians, laboratories, pharmacies, clearinghouses, all those guys and gals are directly in the thick of it every single day. So of course, covered entities, otherwise known as CEs, must be HIPAA compliant. And then you have everyone else. Who is everyone else? Vendors, So I'm sure we have some vendors on this call today, and we do help vendors, business associates, just as much as we help covered entities. Actually, it's about 50-50 in our world. And the vendors that everyone hires to help run their businesses. So at a practice, for example, I want you to think of everybody you cut a check to. Think of the IT company, the billing company, the collection agency. Think of your waste management red bin guys and gals, shredding companies, storage facilities for old files, the people that run your practice management, EHR, EMR. Think about those guys. All these organizations have access to something. They have access to protected health information, name or address or telephone number. There's actually 18 identifiers of PHI. And inadvertently, through no fault of their own, those vendors, due to the omnibus rule, jumping on the bus, business associates must be HIPAA compliant. But Kelly, I'm not a practice. I'm not a doctor. I'm not a hospital, not a clinician. I'm a vendor and I live in the cloud. Or people hire me for services. Who has to be HIPAA compliant on my end of things? All the vendors that you use to help run your business, especially if you live in the cloud. If you're a SaaS-based guy or gal, think about who's hosting and who's taking care of your web needs. Is it AWS, Amazon Web Services? Is it somebody else? All those people have to be HIPAA compliant as well. So even though there's two types of people in the world that have to be HIPAA compliant, with the exception of a few pages of documentation, everyone must do the same thing. And that is very confusing and very convoluted, I'm sure. But the goal here, everybody, is to keep this information safe and secure. PHI, protected health information. And even though people see HIPAA as a detriment, oh, it's so overwhelming and it's too invasive and I don't have time to do it. Same thing with security. Oh, it costs so much to have this installed and this done and so on and so forth. Being HIPAA compliant and being secure can help satisfy your clients, satisfy your patients, make them happy. It's all about retention, guys, especially in 2022. And I wanted to give you some good news when it comes to HIPAA. Now, I know it sounds crazy and you think I'm nuts, but just follow me on here. HIPAA compliance at its core is about finding out what's wrong and fixing it. It's about taking a look internally at your organization, whether you are a covered entity or a business associate, finding out where the problems are, assess those risks, assess, AKA audit yourself internally, take a look and see what's going on. And if you find some risks, fix them and write up some clear policies. It's part of HIPAA associated with such. So here's the method to the madness here. You're becoming HIPAA compliant and you write some good policies for your staff and you train your staff on what they're allowed to do and not allowed to do, what they're allowed to say and not allowed to say. Common sense stuff. I know HIPAA's been around since 1996. We're going on 26 years now, going strong, and everyone in the back of their mind knows not to share this information, PHI, but you're going to hear me echo this throughout. If it's not in writing, it doesn't count. And if you're not teaching it to your staff and having it signed off on, it doesn't count. So if you are taking the time to train your staff, if you are taking the time to have them read and attest to the newest policies and procedures, staff are going to be happier. I know me personally, when I'm trained the right way at my job, and I feel comfortable in what I'm allowed to do and not allowed to do, that makes me a better employee. Guys, HIPAA standardizes operations. It makes operations more efficient for your organization. And happy staff and standardizing operations, who gets the goods in that? Who actually benefits from that? Your patients or your clients. They benefit from you guys being HIPAA compliant because your staff are happier. Operations are nice and secure. They're standardized. Better service overall. This is customer service, guys, 101. Better service means patients stay. It means clients stay. and they refer friends and they refer friends, and that could absolutely increase acquisitions, aka increase profit. So HIPAA can make you more money. That's the bottom line. As silly as that sounds, it's not a bad thing, guys. Being HIPAA compliant is absolutely a benefit to every organization across the board. And, with some good, I'm going to throw some bad in there. I'm going to even it out a little bit. There's some bad news when it comes to HIPAA as a whole and protected health information. 17,000 is the magic number. That's a number of medical records which are breached per average every single day. 89% of healthcare organizations have experienced a breach over the past 2 years. 89% in some way, shape, or form. Ransomware, God forbid, phishing attack, reported investigation. The list goes on, and we'll cover that shortly. And out of all this, 86% of these mistakes, errors that occur, breaches that happen, are administrative. In plain English, are human error. Somebody messed up. Somebody clicked on a link they weren't supposed to. Somebody called Mrs. Smith, Mr. Jones by mistake. Somebody ignored the updates to their computer over and over. Click tomorrow, click tomorrow, click tomorrow. And all of a sudden they were hit with an attack because they weren't up on the latest software. Guys, we're human. Human error is likely to occur, and we want to make sure that you're covered in case something happens. The beauty about HIPAA, everyone, if you're going to take away something from this conversation today, is that no one is ever given a fine for the actual problem that occurs. Not for the breach, lost laptop, God forbid, ransomware attack, whatever it may be. They're fined because they didn't have an effective compliance program in place ready to go to cover them. Let's say that again. They're fined because they weren't prepared. As long as you're able to show due diligence in writing, of course, I's dotted, T's crossed, paperwork up to Yazoo to prove it, you're going to be perfectly fine. As long as you're able to show that due diligence, I trained this person, they read the policies, they still made a mistake, you would actually be found clean. You would be found not guilty for that investigation. Now, I do have a question coming up into the chat. It's a very important question. I am a small solo practitioner. It is just me and 2 employees. Do I have to be HIPAA compliant? Yes. Yes, absolutely. You think the government cares whether you're large or small? They don't. It's the government. They just want you to be HIPAA compliant. Granted, a smaller organization has some less paperwork to do, of course, but everyone still needs to follow the same regulations regardless, because this is all about keeping protected health information, PHI, safe and secure. And patients don't feel good about it. They don't feel confident about HIPAA. Are you confident your healthcare provider is protecting your medical records? 68%, 2/3 are not. Did your provider's negligence cause or contribute to identity theft? That's somebody that had their card stolen at Target. Or they woke up in the morning with a phone call from Visa that they were spending money in Albuquerque and they live in Alabama. They feel as though their doctor's negligence or their organization's negligence might have contributed to it. So not only do people not feel confident about HIPAA, they don't feel comfortable in the organization's practices, companies that they work with overall, even though technology is so important. Come on now, it's 2022. Technology is getting us through this pandemic. Technology is not going anywhere. And if we've learned something over the past 2.5 years, people want more. It is so very important nowadays. People want access to their medical records. People want to make appointments online. It's just the way in the world of the world. 64% of patients would schedule appointments online if they could. 62% of patients want to communicate with their providers via email. Instead of picking up the phone and calling, they'd love to be able to send an email out through a portal or something of that nature like I do. 61% of patients say digital services are important when choosing a physician. We have in the past few years seen a lot of changes going on. People are losing insurance and getting new insurance plans, so they have to pick new providers. People have moved and they're picking out new providers. People are starting businesses. A lot of people are starting businesses, absolutely, in our healthcare realm, in our healthcare space. So keeping this information safe and secure is the number one priority, and ease of use is up there as well. So much so that 2/3 of patients that were in this poll, 2/3, 66%, would switch providers for access to medical records and services online. I will switch my doctor if I can get access to online services. That is the way of the world in 2022. That is why technology is not going anywhere. And that online presence of scheduling an appointment, paying a bill, asking questions to your medical staff is very, very important. And as you can see from the slide, something people are demanding. And since people are online more nowadays, and they're on Facebook, and they're on Instagram, and they're on TikTok and YouTube and Yelp for reviews, online reviews, just as important, if not more so, than in person. Online reviews can help you acquire new patients. It could help you retain your current patients. We know patients worry about HIPAA. We see it in the news all the time. We understand that patients are looking for new doctors. I know when I had to find a new doctor for my family because my insurance changed, the very first thing I did was Google. The very first thing I did was look online at reviews and to see who accepted my insurance plans. And I went on the Facebook moms groups and looked around, and I went to WebMD and I read Yelp reviews as well. That online presence is a matter of trust. You want to keep the information safe and secure. You want people to have access to it in a timely manner. You want people to be able to look at your brand new website and all the positive Google reviews you have so they could trust you. It's all about trust. And unfortunately, 20% of patients are lost annually by practice for some reason. They moved, new insurance, whatever it may be. 68% of appointments that come from existing patients, 68%, 83% of people polled would recommend a practice they trust. If they trust the people that work there, if they trust your online presence, if they trust a combination of everything, they'd recommend it. And 82% would stick with the practice if you trust it. I'm loyal. I'm loyal 100%. I'm going to stick with my doctors if I trust them. But if I don't trust them, if the website looks funny and it looks like it could be corrupted, if I'm reading a bunch of negative reviews, if I don't have a great experience inside the building, I'm going to go elsewhere. Absolutely. Because it's all about building up your brand, having good security protocols in place and being HIPAA compliant and managing that trust for your patients/clients. It's a brand you've built for sometimes years and years and years. You have an amazing logo and you have a great website. And what I'm showing you is a list of things that major corporations across the country implement. Starbucks, for example, and Disney. They have written policies and procedures and standards of conduct for their cast members or employees or whatever you want to call them. They designate someone, put them in charge to make sure those rules are followed. They conduct effective training and education for everybody. They develop effective lines of communication for their staff, and they conduct internal monitoring and auditing. Very important. When I get my Starbucks drink in New York, it's going to be exactly the same drink I'm going to have when I travel to a conference in Texas, for example. They enforce standards through well-publicized disciplinary guidelines and respond promptly to detected offenses. They nip things in the bud. They take care of things. These guidelines are really great customer service. They help you keep your brand intact. And they're also the 7 fundamental elements for an effective HIPAA compliance program. This is exactly what the government expects you to do once a year, once every 12 months. HIPAA is an annual, in order to be HIPAA compliant. I didn't make this up. This is actually a real thing. And there's 1,000+ pages of regulation, guys, to go through. And like I said at the beginning, it's very cumbersome to say the least. But these are the pinpoints. These are the things that you want to do once every 12 months to make sure that you are HIPAA compliant and to make sure you avoid something bad happening, like an audit. First off, what is an audit? A HIPAA-related audit, a HIPAA investigation, is when the Office of Civil Rights, the OCR, that's the governing body here. Let's backtrack a little. Department of Health and Human Services, HHS.gov. They're the guys and gals that wrote all these regulations. Right underneath them is OCR, the Office of Civil Rights. They enforce all the regulations. And my gosh, are they busy? Seriously busy. So all 50 states, DC as well, and Puerto Rico, state attorney generals. State attorney generals have the right to investigate a HIPAA possible violation. And to go to all those acronyms at the beginning of our call today, if you work with any capacity through CMS, the Center for Medicaid Medicare Services, they have the right to investigate a possible HIPAA violation at any given time via an audit. So you could possibly have 3 governing bodies breathing down your neck. And what causes a HIPAA audit? You know, it's not just people say, oh, it's a random thing. They're just going to come knocking on my door. There are indeed random, absolutely, but it's not the number one reason for a possible HIPAA audit. It's the business associates. It is the vendors. It is the BAs. The guys and gals that you hire to help run your business are the number one reason why there's a HIPAA audit. Because by law, by the omnibus rule, they must also be HIPAA compliant. And if they're not, and they have a breach, they're opening you up to that at any given time. The second cause of a HIPAA related audit is indeed random. So they say it's random. We have seen trends in things that they're picking up over the past couple of years. We're going to go over that. Absolutely. Number 3, meaningful use failure. That is that MACRA, MIPS, CMS correlation there. Number 4, reported whistleblower complaint. Okay, let's talk about this one for a moment. A former employee was very upset that they were told to leave the organization, so they reported you for a possible HIPAA violation. And they could do so anonymously, and it has to be investigated. Or you have a current employee who thinks there's a possible HIPAA violation. They can report anonymously, once again on the government's website, via phone call or via a form, and they have to, of course, investigate. Patients or clients, things of that nature, they have the right to report anonymously. They all have to be investigated fully. And breach notification is the 5th cause of a HIPAA audit. What's a breach notification? Well, if you have a breach, if there is a HIPAA-related incident that occurs, you have to report it in a timely manner. If you have just one person affected, that's a minor infraction, minor possible breach. Those can be reported at the end of the year, by December 31st of every year. If it's major, if it affects more than 500 people, guys, you got to report it right away. You have to report it. You cannot ignore it. If you ignore it, bad things will happen, I promise. I'll show you that momentarily. When in doubt, question. You know, I'm not even sure if it's a breach. Okay, well, if you're a client of ours, we help you with that, that's for sure. If you're not sure, report it anyway. What's the worst thing they say? It's not a breach, and it's good, and you're good to go. So these are the top 5 reasons, the things that can cause an audit. And I tell people every single day, keep your noses clean. Make sure you're doing your due diligence to be compliant. It doesn't matter if you're large or small. Everyone has to follow the same exact rules. And the rules are very straightforward on what needs to be done. Most importantly, there's no halfsies when it comes to HIPAA. Bits and pieces of the regulation are honestly an automatic failure. If you're just going to do bits and pieces, don't do anything at all. Don't even bother. You know, we've been talking about security. We've been talking about online presence. We've been talking about ways that, you know, you can help your patients, help your clients, you know, giving them access to online portals, things of that nature. Cybersecurity, though, why care about it? Like, yep, I got a new portal. I don't know if it's encrypted. Maybe the people that hosted it for me are HIPAA compliant. I'm not really sure. Well, on average, more than 1 in 10 sensitive files are open to every employee. So I'm going to backtrack on this a little bit. Employees do not need to have access to every single file. If you hired somebody to work in the front of your office and they've been there for a week, do they need admin rights? Do they need admin access? Nope. The average cost of a data breach in the healthcare sector back in 2020 was $7.13 million. This is why you should care about cybersecurity. And over 50% of organizations have more than 1,000 files open to every single employee. Once again, the nice person that just started a week ago does not need access to everything. And before you tell me, well, these numbers are only for large scale organizations, only the big guys get hit. 1 in 4 small practices, small organizations, startups, nonprofits had experienced a breach in the past. I say nonprofits, guys, because a question just came into chat. Thank you for that. Do nonprofits have to be HIPAA compliant? Yes, absolutely 100%. Your status as a 501(c) or whatever it may be has absolutely nothing to do with HIPAA. You still have access to protected health information. You still need to keep this information safe and secure. And you still indeed must follow every regulation and subreg there is. Smaller organizations get hit with these things. Larger organizations get hit with these things as well. And it really is, the healthcare industry is under attack. It really is under attack. There's so many things going on right now. Ransomware, of course. Cybersecurity experts forecast 5 times more ransomware attacks in 2021 as carried on the 2022. 93% of healthcare organizations have experienced a data breach over the past 3 years. 93%. 62% of hospital administrators feel inadequately trained or prepared to mitigate cyber risks. Remember, if you're training everyone properly, they're going to feel more confident in their jobs, right? No patches or upgrades available for 60% of medical devices that are end of stage life. Okay, so if you work in a doctor's office, the equipment you have in that office, has that equipment, has the software been updated, or did you let it expire? Same thing in a bigger hospital. Same thing if you're living in the cloud and you're on the vendor side of things. Are you working on Windows 7, which is now obsolete? Guys, update your stuff. Update your stuff so it keeps up, so you're not going to get hit with a possible, phishing attack or ransomware. And the main reason why is keeping patient information, protected health information safe and secure. But updating your software, updating your equipment, things of that nature keeps patients safe. There's actually an increase in the death rate among patients. I kid you not. There have been hospitals that have been hit with ransomware attacks and their systems have been down, and nurses have not been able to give medication to patients because systems are down and codes cannot be answered. Horrible things happen. We need this security. We need this tech in our lives in order to help as many people as possible and make things more efficient as well. And before somebody says to me, back in the day on paper files, it was so much easier. Listen, I've also worked on the clinician side as well. Files get lost. People are given wrong medications because it was written in the wrong chart. 1,000 different things happen. As long as you're diligent, whether you're in the cloud, on paper, a hybrid of both, you're going to be perfectly fine. Now, let's talk about the sources of these attacks very briefly. A phishing attack. If you're not familiar with a phishing attack, you get an email and it looks like it's a real email. It looks like it came from Target. It looks like it came from Amazon. And you click on that link and it wasn't Target. It wasn't Amazon. Okay, well, how about this one? You work at a smaller office and you get an email from your coworker. Hey, meet me for a meeting quick. Click here. And it looks a little bit fishy. It looks a little bit weird, hence phishing. So get up and walk to that coworker and ask them if they sent that email, or pick up the phone next to you and call them. Just don't click on it, please. Lost or stolen devices. So there's a couple of things to take into consideration nowadays. People travel with their laptops and their tech, which could have information on it, and things get lost, things get stolen. People work from home, things get stolen as well. Vendor hacked. Okay, so you could have been hacked, ransomware attack, things of that nature, or just general theft. An office is broken into and stuff was stolen. These are some of the main reasons for these attacks overall. And we're all blaming technology. We're all blaming technology. Oh my gosh, it's the tech. We're too advanced in our times. And in reality, guys, technology is not the problem. We are the problem. Humans are the problem. In reality, tech is not the problem. 86% of lost devices, malware attacks, phishing attacks, or staff disabling security features was human error. Somebody clicked on a link they weren't supposed to. Somebody didn't update something they weren't supposed to. Guys, we're humans. It's likely to occur. But honestly, as long as you are compliant, as long as you are dotting those I's, crossing those T's, like I said, no one's ever fined for the actual problem. As long as you try your hardest with this, you're going to be perfectly fine. This is not trying your hardest. I'm going to keep this one up here. This is my guy, Bob. I don't think that's Bob's name. I love Bob so much. If you've ever listened to a webinar of mine before or seen us in person at an event, I bring this up every single time. So quick background on Mr. Bob. Bob's a real person. This is a real story. He is the executive director of the emergency medical systems for the entire state of Hawaii. And Bob was being interviewed by a major news publication on the system because it's a very robust and advanced system. They have to cover all the islands. They have to cover a possible, tsunami or horrible things they have to cover. And they just have a really great system in place. So here's Bob. He's so proud. He's standing there. He's got his awesome shirt on, taking pictures. Now, look at what's on Bob's computer. Scroll in. That is Bob's password to the entire 911 system, written on a Post-it. And of course, the media went nuts with this. They had a frenzy, as they should. Bob messed up. Human error, guys. It's likely to occur. And even though Bob, so smart and knew about security, he's a tech guy. IT guys know their stuff. He made a mistake. Once again, we're human. We talk about security being so important. We talk about compliance being so important. Talk about marrying the two of them, putting them together. Compliance is like, well, it's not a tech problem. It affects everyone in the organization. Yeah, compliance is mandated by law, but it's so technologically vague. Oh my gosh, the regulations are really archaic. And it's also impossible without security. And security is like, well, it's all about risk management. We have shades of gray and we got to work around budgets. And, we are required in order to be compliant. Compliance mandates security. It's about managing the risk. It's about managing the possible fines and keeping everyone safe. This is exactly why you need both. You cannot have one without the other, because if you have one without the other, or none at all for that matter, you're going to wind up here. This is what we call affectionately the HIPAA wall of shame. No, I did not make up the name. This is a real thing. So if you Google HIPAA wall of shame, what's going to come up is the Office of Civil Rights website, OCR. What they have is a list of breach reports, things that were reported, large and small. And this is a permanent list, guys. Permanent. Doesn't matter if you found not guilty, you're on here forever. And people could actually go on this list and manipulate it based on state, based on vertical, based on specific area, based on the type of breach. Once again, online presence is everything, and we want to avoid this from happening. Nobody wants to be on the wall of shame, and nobody wants fines. This happened September 15, 2020. I'm using this. This is an older reference, but I'm putting this out there. There's a method to the madness, guys. 5 fines in one day, which back then was basically unheard of. And this happened at the height beginning of the pandemic. Most of these fines were for what's called right of access laws, and we're going to get into that momentarily. The government doesn't care that there was a pandemic. Still is a pandemic. Government doesn't care that you were temporarily closed or you were short-staffed or you just didn't have time for HIPAA. These are all smaller organizations, nonprofit, doctor's offices, psychiatry, so on and so forth. The government doesn't care. They just want you to be compliant. And the trend that we're seeing, I said a few slides ago that these audits, these investigations are random sometimes. We're seeing trends big time. Absolutely. Let's talk about the right of access law. The right of access law is getting your medical files to patients within 30 days. It was supposed to go down to 15. It's not official. It's not on paper as of yet. People move. They change insurance plans. They're changing doctors. They want their stuff. They have access to, they have the right to have all their records, progress notes, doctor's notes, radiographs, everything. And if it's held back for some reason, I'm short-staffed, I don't have time to get this out to them. They owe me money, so I'm not going to give them their records. I'll get to it next week. We're on vacation. No, it doesn't work that way. I'm sorry. People have the right to their stuff. And the trend we're seeing over and over again is that people are getting fined for not giving over medical records, that right of access law. This could be avoided completely. Why bother playing with fire? How do you protect yourself from the right of access? Fines. Well, I want you to think of it like a customer service issue. Hey, we have a request for records. Be respectful of this. Everyone has the right to their stuff. Process access to that in a timely manner within 30 days. And if you're not able to make that 30 days for whatever reason, notify that patient, notify that client, let them know. Let them know. Absolutely. And provide the individual with an easy means to request and pay for the records. You can charge them a little bit in most states. Definitely check your state. You can't charge them an exuberant amount of money, and you cannot hold it back if somebody owes you money. Absolutely not, guys. That's ethics 101 at its finest. So what have we been learning, in this webinar? That the right of access to medical records is real. It is so real. Healthcare providers should maintain effective and responsible right of access policies and procedures. Do not be insecure. Conducting the security rule, security risk assessments, things of that nature is as important as ever with the technology we have in play. And also, silence isn't golden. So the right of access rule really came into effect for this guy. Dr. Robert Glazer is a real doctor. He's based out of New York, Long Island, New York. Be proud, my local people. Dr. Glazer is a cardiologist, and he had multiple patients requesting information, requesting their records. And finally, some people reported him. Anonymously or not really sure. But here's the kicker. Dr. Glazer received in the mail an initial data request from the Office of Civil Rights. Hey, we have some complaints here. Can we talk about it? Can you give us some information? Silence. He did not answer. So they sent a second letter. Silence. Did not answer. They called the guy. Refused to answer the phone. Subpoenaed him. Did not show up in court. Automatically $100,000 fine. Answer the phone. Answer the phone. Answer the letters. Silence is not golden. I'm sure they could have worked out a corrective action plan in reference to this. There might have been a smaller fine. And before somebody says to me, my insurance company will cover a HIPAA violation. Will you be covered if you burn your own house down? I think not. Nobody, no insurance company is going to pay on willful neglect. You knew you had to be HIPAA compliant. You chose not to. We have a question coming into the chat. Is the slide deck available? It will be. On the recording, you're going to be able to see everything. Absolutely 100%. Thank you for the question. So what can you do right now? What can you do today? Take a screenshot of this. What can you bring back and implement right away here on the security side and the HIPAA side? We'll get HIPAA compliant. Absolutely. Strong passwords. Not everyone in the office should have the password or the password admin. Show your members what to look for. Members, patients, clients, train them on cybersecurity training. That is something we offer complimentary to our clients. Show them, hey, this is what a ransomware attack looks like. This is what a phishing attack looks like. If you show them and teach them, they'll know to avoid those things. Restrict unnecessary access. Once again, Mary, the front desk person who started last week, does not need to see everything. Keep anti-malware up to date. Please stop clicking that you will update your computer tomorrow. You will update your malware the next week. Stop putting it off. Just update things. And ensure a backup plan. Have a backup plan in place in case there is something hacked, in case there is a possible ransomware attack, in case there is a possible HIPAA violation. It's actually a part of HIPAA right now to have an incident plan in place, ready to go in case something happens. And that way everyone's not freaking out. You got a plan in writing ready to go to cover you. All right, we got dinged. What are we going to do? Oh, Mary's going to call the IT guy, and John's going to run home to go get the backup drives. And Joe's going to call the patients for the day and say, hey, we can't see them because our systems are down. You got a plan. It's going to bring it back up online much sooner than not having a plan. And it's also deeming you HIPAA compliant. Now, there's this really cool resource that we offer called the HIPAA checklist. You might have seen it before. We could definitely get you a copy if you like. The checklist is invaluable. It shows you exactly what to do each year to be deemed HIPAA compliant. And here is my information, everyone. Definitely feel free to take a screenshot. We are here and happy to answer any questions you have, any concerns that you have as well. Feel free to reach out anytime. There's no silly questions here. Once again, it is HIPAA. I see another question coming into the chat here. Do vendors outside the United States have to be HIPAA compliant? Oh, that is an excellent question. Thank you so much for bringing that up. So yes, if you're doing business in our country, you're going to follow our rules and you're going to follow HIPAA. If you're in the healthcare space, regardless of what country you are in, you're going to follow HIPAA. And we actually work in several countries across the world, so there's something we could definitely assist with. Absolutely. All right, guys. Well, I want to thank everyone so much for jumping on the webinar today. Once again, you're going to have 2 very quick questions popping up on your screen immediately after the webinar. Thank you so much for joining us today. Please stay safe and enjoy the rest of the week. Bye for now.